Well, welcome everyone. We're glad you all could be with us for this really exciting presentation that we'll hear from Dr. Kevin Osterhoudt. Um, Dr. Osterhoudt is a pediatrician who serves as the medical director of the Poison Control Center at the Children's Hospital of Philadelphia. He's a professor of pediatrics in the Perelman School of Medicine at the University of Pennsylvania, where he has been inducted into its Academy of Master Clinicians. He's been recognized by the American College of Medical Toxicology for significant national and international contributions to the educational pursuits of medical toxicology. And while a member of the Executive Committee of the American Academy of Pediatrics Council on Environmental Health, he contributed to the 2016 AAP policy statement on prevention of childhood lead toxicity. Dr. Osterhoudt has provided care to children with severe lead poisoning in Philadelphia for more than 30 years and has been a lead poisoning consultant across the U.S. and internationally, including in Kosovo, Vietnam, South America, and Africa. We're very pleased to have him as a member of the Philadelphia Regional Center for Children's Environmental Health and look forward to his talk with us today about some updates on taking care of children with lead.
And I've got to admit, these little packages of applesauce, I think were a brilliant invention. You can put them in your backpack. You can put them in your diaper bag. You can pull them out. Kids get a great oral and tactile stimulation from using them. And even though I think they were intended for children, my brother-in-law loves them. I see them all over the place. And so they have been really, really cool from that regard. So in the fall of 2023, when several brands of these kids' applesauce pouches were recalled by the FDA because they were found to contain high levels of lead, that created quite a story, and that story has legs, and it continues today. And so we're going to talk a little bit about lead in the applesauce and in the Lunchables and in other things like that. We hear these stories from time to time about metals and bad toxicants in our food. And the one I really remember taking the country by the biggest storm was back in 2011 when Dr. Oz on his TV show announced to the world that there's arsenic in the applesauce, right? And the story was met with a lot of controversy. He applied EPA limits on arsenic in drinking water to applesauce, which might not have been the best, or to apple juice, which might not have been the best comparison. And he didn't have the best scientific methods in his analyses, but I thought it was great in that it brought this issue to public consciousness, at least for a little while. And of course, there's arsenic in the apple juice, right? Because we know that arsenic is a naturally occurring element on Earth, and it varies geographically. And there are belts within the United States where we see that there's more arsenic than others. That's why I think our New Jersey cranberry bogs would love to say that their cranberries are better than those from Washington State or Oregon, because there's less arsenic in the New Jersey cranberries. And it varies by belts across the world. And I even remember one patient that I saw in clinic and consultation who was seeing an alternative healthcare advisor who explained to the family all of the hazards that were in dairy and the dairy supply and the way that farmers were managing dairy, and suggested that they leave dairy completely and go to a rice milk diet. And they took that by storm, and they only gave their children rice milk, and they only gave their children rice cereals, and they continued to do that. And then that provider actually measured their urine arsenic and found that their arsenic is very high, which is not surprising since rice is grown in the ground where the arsenic is. And then they prescribed them supplements to treat that arsenic poisoning that they had. And those supplements contained mercury and lead and arsenic, so that the metal excretion just continued forever and the supplement sales just continued forever. And it's an issue that we see all the time. Now, it didn't help that we as humans brought arsenic into our pesticides that we sprayed on our orchards for a long time, and that we've used arsenical coatings on our wood to make our playgrounds and our back decks. And we brought arsenic into the world in so many other places. We see these reports of metals over and over. In 2021, the US House of Representatives actually released a congressional report about our baby foods being tainted with arsenic and lead and cadmium and mercury. And there's nothing more sacred to us than our baby foods and what we're feeding our children, right? And we all know that there is mercury in seafood, and I like to fish. And in Pennsylvania, the beginning of trout season is in April. And so every year I get my fishing license and I get the little booklet that explains to me that in Pennsylvania, if you recreationally catch a sport fish, you should only use it for 1 meal per week. And that's based on both the mercury that's in that fish and also dioxins. And we see that, and we know that there's this mercury cycle where mercury goes up into our environment from both natural and from man-made sources. From there, it goes into our air, it comes down into our soil, it comes into our water, it bioaccumulates in our microorganisms, which get eaten by our fish, which move up the food chain. And so that mercury gets back to us as human beings. And then in April of 2024, right, we found out the Consumer Reports told us that there were even high levels of lead in our Lunchables. Can you believe it? In our Lunchables. Of course, if you're eating Lunchables, probably that lead, cadmium, and phthalates is the least of your worries. And if you're from the Lunchables company, that was just a joke. I don't want you to sue me. It must be a fine lunch meal. But that brings us back to this event, right? That there were elevated levels of lead in these cinnamon applesauce pouches that were recalled in November of 2023. And people wondered, like, well, how does that happen? So let's start the story with how this was discovered. And I have to admit that as I talk about how this was discovered, I'm a little bit foggy on all of the details of this. What I kind of know is that there were a couple of children in North Carolina who had blood lead testing done, and they were found to have blood lead concentrations in excess of 20 micrograms per deciliter. And being high, right, that led to a public health investigation and intervention. And so we have to say, all right, where could that be coming from? Well, in most of the United States, when children have elevated blood lead concentrations, the source usually tracks back to house paint, or at least the dust that deteriorates over time from house paint. And that's certainly the story with my career here in Philadelphia and in Pennsylvania, where our housing stock is so old, and it's maybe a little bit less common in North Carolina. And when they looked at the house and they looked at the house paint, they said, boy, there's really no hazards there. So then we need to think about other sites where children may spend time. So we may think about a grandparent's home. We may think about the daycare that they go to. And they looked at those and they said, wow, there's really no lead there. So then we might think about soil and we might think about water supplies, and they gave that some consideration. We'll often then go to hobbies, and people that spend a lot of time in gun ranges where lead bullets are fired can pick up lead dust. The lures are mainly the weights that I use fishing are often made of lead. So we think about that. People doing work with jewelry or stained glass or maybe antiquing could have exposures to lead. They didn't find any sources there. We might think about jobs and people that are still using lead paint on ships or on the undersides of bridges might have exposures. We can see exposures through demolition. We can see exposures through recycling, but really no exposures there. And then we sometimes think about imported cosmetics, imported jewelry, painted glassware, painted toys, and they were just really scratching their heads because as they went through this, they couldn't find a source of lead. And then there was some kind of a conversation where the family said, well, they do eat a lot of these applesauce pouches. And that led to an investigation of the applesauce pouches. And I think that probably came from, for a long time, we've known that spices could be contaminated with lead. And we'll talk about that a little bit more. But when they analyzed this applesauce, they found that this applesauce had a median lead concentration of 2 parts per million. And 2 parts per million in other units is 2 micrograms per gram. And right off the bat, that doesn't really mean much of anything to me. So we need to look at that math a little bit more, right? And so there was no regulatory limit in place on how much lead could be in baby foods, but the FDA had been proposing some action, and the FDA's proposed action level for lead in baby foods was going to be 10 parts per billion, which is 0.01 parts per million, which means that this applesauce had a median lead that was about 200 times the proposed action level. Now, every day in the world, we all are ingesting or breathing in a little bit of lead. And fortunately, our body has kidneys and other ways to try to protect ourselves from toxicants and to detoxify things. And the CDC has tried to estimate how much lead is too much to ingest where your body starts to accumulate it. And one estimate has been that if a child takes in more than 3 to 5 micrograms per kilogram per day of lead, their body will start to accumulate and build up higher and higher blood lead concentrations. And so for a 1-year-old child who's 10 kilos, using the upper limit of that estimation, that would be ingesting more than 50 micrograms per day. Well, if you look at the amount of lead that was in this applesauce, and if you know that one pouch of this applesauce was 70 grams, that meant there could be as much as 140 micrograms of lead per pouch. Then the question is, how many pouches do you eat? 1, 2, 5, 6 in the day? No matter how many you do, this number actually astounded me when I started to do the math. It was really quite significant. And I said, wow, this really could be a problem for some of the children, depending on how much they ate. And so the CDC and the FDA have both kind of followed this, created definitions for confirmed cases, for probable cases, for suspected cases. And as of January 17th, 2024, which is the last time I put these numbers together, they had decided they had 93 confirmed cases of children with elevated blood lead concentrations from eating these applesauce packets. They had another 233 cases that they thought were probable, 28 more that they were still working through, and that these spanned over 41 states. And again, I'm here in Pennsylvania, and I could turn to 6 Action News to learn that more than 20 of these cases at the time were in Pennsylvania. And so this was a problem all over. And so then it gets to the question about, well, why or how would applesauce end up with lead in it? And that gets me back to the idea that throughout history, lead has probably been the most useful pigment of all time. And when we think about pigments, we might think back to, again, house paint and the challenges we had with lead in house paint. And there was actually a time when the old Dutch Boy Paint Company used to call their white paint not white paint, but they actually called it right on the label white lead. And that white lead was bright white. You could clean it. It was durable and all those things we loved, unfortunately, had lead in it. And actually, when you go back and you look at our artwork over history, you would see that, wow, even the Mona Lisa was painted with lead, and all of these famous painters used lead pigments in their paint and their artwork. And I don't know if anybody's been watching the news this week. I loved a story from last week where somebody went back and tested locks of hair that they said were from Beethoven, and found that Beethoven had very high lead levels in his hair. And they wondered if that contributed to some of the hearing problems he had, or other maladies. And so we see lead all the time through history. And when we talk about lead as pigments, lead tetroxide, or I'm sorry, lead chromate used to be called yellow lead. And here you see a little bottle that holds lead chromate, and you see, yep, wow, it really is yellow. And when you look at it in comparison to spices, it actually has a similar color to turmeric, to curcumin, to curries, and maybe even to some cinnamons, right? When we think about lead tetroxide, that was known as red lead. And that was similar in color to paprika and to cinnamon. And you can see at the top of the photo here, there's a little news article out of Kansas City about the health department issuing warnings about bulk paprika because it had lead in it. And I don't know if you can see the date. The date's pretty small, but that's from 2012, right? So this is not a new issue. There has been lead in spices for a long time, and the color is quite similar. In addition to color, lead is sweet. Back in 1857, Scientific American wrote about lead acetate and talked about how it has the property of imparting the sweet taste to fluids. And they actually, at the time, called lead acetate sugar of lead. And a lot of times the wine back in those days, I guess, was pretty nasty. There was this drink called Sapa that was similar. And if you had very cheap wine, it was really bitter and foul. You might actually add a lot of lead acetate to that to make it sweeter and to make it easier to drink. And when you think back to Victorian England or you think to post-colonial Philadelphia, they were actually fairly polluted places. The Thames River stunk from sewage and garbage. Having clean water was a luxury. And lead was used in crystal glassware and lead cups and in cookware. And lead acetate become very important as a sweetener to just make life better. I think this next part is really pretty shocking, right? And that is we've tried to take advantage of the sweetness of lead medically. And in the 1800s, if we were having trouble feeding babies who had colic, you could actually go out and you could buy a lead baby bottle nipple. And the idea was that a baby would latch onto this nipple and enjoy it because of that sweet lead taste and be more likely to drink. And similarly, they created nipple shields to help nursing mothers protect their nipples during that nursing period. And these lead nipple shields were finally seized by the FDA in the 1930s. And they said it was due to a failure of the labeling to reveal the material fact that fatal lead poisoning might result in infants fed from the breasts of mothers using the appliance. And so lead has been all around. So how does lead get into the spices? Well, there are a bunch of ways, right? So we know that lead is in the ground, it's in the air, and we can just get environmental contamination of the raw materials if we're not careful. And especially if those raw materials originate from countries that haven't enjoyed the same safeguards that we have enjoyed in the United States. Lead solder can be used in metal in containers and storage tanks, and even in some of the grinders used to grind down these spices. And if the spices are put into ceramics or other painted surfaces, they can pick up lead there. But after investigation, the FDA's jargon was that they believed that this was an EMA, or an economically motivated adulteration. And that's what we have seen over time. When you think about lead, we think about lead as being heavy. And it turns out that bulk spices are sold by weight, by the gram, by the kilogram, by the pound, by the ounce. And so if we can add lead to them, we can get more value back in money from them. Also, that lead pigment is really, really nice. And if we have some plants that aren't so good, or maybe have some fillers, and if I make a cinnamon or a paprika that doesn't have that nice bright color, that enjoyable color that's appealing, maybe mine won't sell as well as somebody else's. So if I put that pigment in, it'll be better. So I can get two things from this, right? I can get a better looking product and a heavier product, and that will bring me back more money. And in this case, with this cinnamon flavored applesauce, this was actually traced back to a plant in Ecuador where they believe that lead chromate was added to the cinnamon before its exportation and importation by the United States. So the next question I get was, okay, so I have a child and boy, I gave them some of these some of these applesauce packets, and I'm worried that they could have got lead in them. What do I do? And so I always teach that there are three primary priorities when treating a child with an elevated blood lead concentration or with lead poisoning. And the first priority makes sense, right? It's prevent further exposure to lead. So we're going to say, all right, what we want you to do is stop using these applesauce pouches. Let's make sure that we have a good, clean, nutritious diet. Let's look at other sources of lead that might be in the environment, and let's get rid of that too. The second priority is to prevent further exposure to lead. And the third priority is to prevent further exposure to lead. And that's going to be the number one way. And it would actually be great if we could prevent lead exposures before they ever happened, right? But it's also our primary treatment. And when we talk about this, we often get into talking about lead levels and what's a normal lead level. And that's interesting too, right? Because lead has no role in the body. And from that standpoint, a biologically normal lead level would be 0, right? It shouldn't be there. If we were born in a bubble, it would be 0, but we're not born in a bubble. We're born into the world, and in the world, we have exposure to chemicals. The principal ore for lead is called galena, and when I say blood concentrations are 0, and we talk about normal things, we often talk about the normal distribution, but blood lead concentrations aren't normally distributed either. They're skewed down towards normal. In 2021, the CDC called the blood lead reference value for lead 3.5 micrograms per deciliter. And there has been a lot of confusion about what this number means, okay? This threshold is not a threshold that differentiates toxic from non-toxic. It's not biologically derived. It is not a definition of lead poisoning. It is simply a statistical construct of normality, or what we call the normal bell-shaped curve. And what it is designed to do is to identify that 2.5% of the population who are higher than everybody else, right? And by convention, by US Census data, that means we expect 575,000 children to have a higher blood lead than the other children. And actually, this number of so-called affected children will never, ever change as long as we continue to change this blood lead reference value based upon our improvement of blood lead and blood lead prevention over time. And our interpretation of what's a high blood lead has changed dramatically over time. I was a child in the 1960s. When I was a child, you weren't considered to have anything akin to lead poisoning unless you had a blood lead that was higher than 60 micrograms per deciliter. As we began to learn more about the harmful effects that were more subtle, the neurocognitive effects, the behavioral effects, we began to bring those numbers down. And in the 1970s, the CDC used the term undue absorption of lead for blood leads at first that were 40 and then down to 30. By the time I was in college, they changed the term of that to be an elevated blood lead level. And you were considered to have an elevated blood lead level if you were higher than 25 micrograms per deciliter. And by the time I came to the Children's Hospital of Philadelphia to start my pediatrics residency, the CDC had changed the nomenclature again to a level of concern, and the level of concern was considered to be 10 micrograms per deciliter. In about 2012, we changed that now to a blood lead reference value. And instead of trying to decide what was toxic, what was not toxic, decided to just make it the statistical construct threshold. In 2021, it went down to 3.5. And again, every so many years on out, we hope to be able to reassess that and make that number lower and lower and lower. And we talk about lead and the dangers of lead and the hazards of lead all the time. Sometimes I think it's important to step back and say, you know what, the reduction of environmental lead exposure is actually one of our great environmental success stories. And indeed, the CDC declared it as such in the MMWR as one of the 10 great public health achievements that we had gotten to. And we achieved this through primary prevention, right? In the 1950s, there was a voluntary decrease of lead in house paint. In 1978, the CPSC banned lead paint in the homes. And by 1996, we had completely phased out leaded gasoline. Pre-1950s, house paint was commonly 10% lead and as much as 50% lead. From 1950s to 1978, it was down to 1%. And this led to great historical improvement. When you go back and you look at the United States during the Industrial Revolution, lead was ubiquitous in homes and in goods. And when you look at the Roman Empire, colonial Australia, Victorian England, there are all these descriptions of children with eclamptic seizures, with limb paralysis, with neuritis and meningitis. And I don't know that the Daily Mirror is the same as the New England Journal of Medicine, but they published this article suggesting that in Victorian England, 150,000 infants died each year due to their exposure to lead. And for us in the United States, it's actually very rare to see cases of lead encephalopathy anymore. As we look at this environmental success story, remember in 2021, we said that there are less than 2.5% of children nationwide expected to have a blood lead higher than 3.5 micrograms per deciliter. Compare that to when I was in high school, even when the mean US blood lead level for children tested was about 15 micrograms per deciliter. And it was estimated that 88% of children had blood leads higher than 10 micrograms per deciliter. Or even in the 90s, again, when I was doing my residency here at Children's Hospital of Philadelphia, when the mean US blood lead had dropped to less than 3 micrograms per deciliter, and only 4% of children were higher than 10 micrograms per deciliter, to 2018, when the geometric mean was finally under 1 microgram per deciliter. So that's really, really remarkable success at cleaning our environment. And you can see it here with some of the public health interventions that we had made, and how there was a decline in both the number of children who had blood leads higher than 10 and the mean blood lead among children that we tested. And we can even see that in Philadelphia, and that there has been a decline in the blood lead concentrations of children. This is just a graph since 2010, so long after a lot of those improvements have been seen. I will say, on a disheartening note, we mentioned that nationally, we think that only 2.5% of children should have blood lead concentrations higher than 3.5. And here in Philadelphia at this time, it was 11%. So we're 4 to 5 times worse than the national average in Philadelphia, which again isn't surprising looking at our history of early settlement in Philadelphia and in Pennsylvania. But lead remains a huge global burden. The picture on your left is a child with frank lead encephalopathy. She had seizures. She's in a coma. This is in a hospital in Dong Mai, or actually a hospital in Hanoi, Vietnam, where this girl had been transferred from Dong Mai, Vietnam. And Dong Mai was a village that discovered that they could develop some economic success by bringing in electronics from places like the United States and Canada, and sifting through those electronics and reclaiming the precious metals, especially lead, and smelting those down. And it became the entire village's work effort to get this lead, and the children got significantly exposed. The University of Washington and my colleague Catherine Carr did a number of studies and found that every child tested in this village had a blood lead higher than 10, with a significant percentage having blood leads higher than 70, which is as high as their field instrumentation can go. Right now, we're seeing lots of cases of lead encephalopathy in Africa associated with artisanal gold mining and child labor there. That's been reported in the literature, and we're seeing exposure to cobalt and so many other metals from this practice. And at the Children's Hospital of Philadelphia, I'm part of its global health program. One of our bases in global health is in the Dominican Republic. And there is a town not far from there that's considered one of the most polluted places for children in the world. And so lead remains a problem all around the world for children. And here, we have a growing concern for low lead levels. And what most of the epidemiological studies have shown us is that any detectable lead in the body is abnormal, and no level of lead in the blood is safe. And when we look at population-based studies, even low levels of lead have been associated with decreased cognitive function, decreased performance on behavioral scores. And that has led to very interesting messaging. And, again, as an advocate, I'm always saying, let's get the lead out. There's no level of lead in the blood that is safe. And that blood lead concentrations, once thought to be harmless, have significant impact on children's ability to learn. And just to point it out, that photograph is a little child holding a toy train. That's Thomas the Train. It was a very popular toy sold in the United States. You can imagine kids would play with that. They'd put it in their mouth, they'd teeth it, they'd bite it. And all of those Thomas the Trains were recalled because they were painted with a lead-based paint when they were distributed. But it's time that we talk a little bit about risk communication. And I saw that Dr. Sid Roy joined the conversation here, and maybe Dr. Roy will want to comment at the end of the presentation a little bit. but we have a real problem with risk communication. And let's think about a child whose parent finds that, wow, I've been giving my child some applesauce, and some of it was this recalled applesauce. And I live in Pennsylvania in a house that was built in the 1940s, and it's probably got some lead in it. And my child's daycare is in an even older building. And I went and I got my blood lead test, and it was 5 micrograms per deciliter. And I'm really, really worried about that. Well, what do we say as healthcare providers to that family? And I think there are two options of the way to message this. And the words I'm going to use aren't going to be the best words. I shortened them so they'd fit on slides and so we could have a discussion. But option one, and the way I see it done a lot, is we say, oh, there's no safe level of lead. No lead is safe to his brain. And that level means that he's worse than 98% of children, right? And when you think about that message as a parent, this is just devastating because we all want our children to grow and to thrive, and the brain is sacred to us. And what a horrible message. And we go home and we feel badly, and that just interferes with every part of our life. Another way to deliver this message is to say, wow, I share your concern that he has that level of lead. Did you know that his level of lead is actually lower than 80+% of all Philadelphia kids have been in the last 50 years? But we can work together and we can get it even lower, and we can find ways to stimulate his brain, and we can work together to get by this. And I would argue that those two messages and those two modes of messaging have very different effects on families, and probably will result in very different outcomes. So over the course of my career, it sometimes strikes me that people think about their children kind of the way that I think about sausage. Everything looks good and it seems great until you find out what's inside, right? And that's kind of our issue. And as a clinician who frequently counsels patients with worries about environmental exposures, I often find myself curious about what scares families and what doesn't, right? A lot of people, they go and they buy a new car and they sit in a new car and they take that deep breath and they love that new car smell, right? Marilyn, don't they worry about those volatile organic compounds that they're inhaling? Or then they drive that car off and they go to the gas station and they have the windows open and they have the baby in the car seat in the back seat. And they don't think at all about the benzene that everybody is inhaling. And the truth is, we live in a very polluted world, and a lot of that pollution is natural, right? It's stuff that's in our soil and it gets put up into our air. But a lot of it is man-made, and things that we should have done better and that we can do better. And where I don't tell any of my patients to ever go looking, but maybe the group on here, well, this is an educated group, and so maybe you already all know about the CDC's National Report on Human Exposure to Environmental Chemicals. And if you don't, it's very, very interesting, because the CDC actually measures a lot of different chemicals in people, and it's really quite illuminating. So fortunately, I have never, ever, ever in my career had a family come to me and say, Kevin, I am worried about my child's 2,4,4 tribromodiphenyl ether concentrations. But lo and behold, if we measure that chemical, it's found in everybody. Everybody's got that in them in measurable quantities. And that is a chemical that was used as a flame retardant in clothes, in pajamas, in furniture, and carpets, and things like that. And it's become ubiquitous in people, right? And similarly, I get a lot of people that come to me for lead, quite a few people that come to me for arsenic, occasionally really interesting cases in mercury. And it's not very often that people come to me worried about their cadmium, and we're not measuring cadmium. But again, if we look at urinary cadmium, everybody has cadmium in their bodies, and we can find that too. And so they're all around. There are a lot of chemicals. And so what can we do about them? And so everybody on here will be familiar with this concept of a LARA. And what we need to do is to work together to keep all of these exposures as low as reasonably achievable. And what's reasonable for one person might be different than what's reasonable for another, right? It's kind of like the chocolate chip cookie 3-second rule, right? When you drop the cookie on the floor, if you pick it up right away, can you eat it? Do you go 3 seconds, or does it go right in the trash can? And we all feel differently about that. But Alara goes further than that, right? We need research. And so organizations like the PRCCEH are so important as we identify, well, what are the hazards? Where do those hazards exist? That research is medical research, but it's also engineering research, it's geographic hydrology research, it's educational research. And as we develop our advocacy messages and as we try to educate families so they can make good choices for their children. And in a way, I see my job as being really easy, right? Because I'm an anti-lead advocate. I can stand at the street corners, I have many times, and say, lead is bad. We need to get the lead out. We need to prevent lead poisoning. And my job is really easy. But we live in a world with finite funds. And the job of civic leaders is really, really, really hard. So if today I had $1 million and I could take it over to a neighborhood in Northeast Philadelphia and I could say, hey, neighborhood, I have $1 million here and I can give that to you. And I can give that to you and we can use it and we can devote it to trying to lower your lead exposure and to get your children's blood leads from 6 down to 3. That would be a very noble thing to do. But is that what the neighborhood would choose to do? Or would they say, you know what, we live in a food desert and what we need is access to secure food supplies, or so many of the other public needs out there? It's really, really challenging. We also need to support our watchdogs, and I hear all the time, and I see on my public media, social media feeds, people really coming down hard on abolish the EPA, abolish the FDA. They're interfering with business, and it's not until you found out, like, hey, I've got lead in my applesauce. Why didn't anybody do something about that? That we realize we really, really need them. And I put up the webpage from the Food and Drug Administration, and they have a Center for Food Safety and Applied Nutrition, which actually works to try to help protect our food supply. And I think that's really, really important, which makes us really, really lucky in the United States. So we need to support them vocally, with money, with votes, and make sure that they can do their jobs. In terms of the applesauce or the rice milk or whatever else is in our food supply, the best thing that we can do is eat a balanced diet of a variety of different foods, and I think that will serve us best. And then it's important that we look at all of these things that child injury advocates talk about as adverse childhood experiences. There are a lot of them, and they all work additively or even multiplicatively with things like lead exposures and arsenic exposures and mercury exposures. And so if we can all work together to make the world a better place for our children, we're going to make a lot of this better. So if you're interested in learning more, the New York Times actually just recently did an article that went through how this lead-tainted applesauce managed to get through our watchdog agencies and get out in the market and be bought by people. And so you can pull up this New York Times article and you can read a lot more about that story if you're interested. The American Academy of Pediatrics did ask me to comment about this in a couple of different venues. So you can go on to healthychildren.org and you can read my blog post about whether you should worry about lead in your children's cinnamon applesauce pouches. I also did a little podcast with the American Academy of Pediatrics on the topic that you could listen to if you want to. And then, I think a lot about lead and where we have been and where we're going and what its current social context is. And so if you'd like to hear more about that, the Children's Hospital of Philadelphia has an online education network called CHOP Open. And I have a hour-long Grand Rounds talk there called Childhood Lead Poisoning, a Dickensian story that you're welcome to go on and read for. I think you have to register for it, but it's free and you can listen to that anytime you want.
I think that fits well with what I've been seeing, which is that people who do renovations or hire contractors to work in their homes, just don't think about the need to hire someone who's certified for lead. And I'm wondering, are you seeing children that come in with elevated lead levels from that as the source, a recent renovation in their home?
Yeah, we certainly do, and we see them in both ways. When you renovate lead that's encapsulated, you create lead dust, and that lead dust increases the hazard for the children. Sometimes we'll find that when a child gets a capillary blood test and it's greater than 100 and makes everybody scared, and we find out, fortunately, that their venous lead isn't so high, but they had lead dust on their fingers. But we do see high levels in that setting. And yeah, oftentimes, families go out and will buy a nice 1880s farmhouse and think like it's a great thing, but can lead to troubles. And I see Dr. Carla Campbell's on the line. Carla was a colleague that taught me so much about lead for so long here at Children's Hospital and was so instrumental in creating so much of the lead court system in Philadelphia. Carla, I don't know if you have any thoughts or comments you'd want to share on that.
Well, thank you for a wonderful lecture, Kevin. It was great. I did have a question about your global exposure page slide, what the source was for the Dominican children.
Yeah, in the Dominican, it was a lot of industrial lead that was dumped out into the soil and into the water, and there aren't good methods for cleaning or assuring good water sources in that community, and the exposures are actually myriad there. There's so much different industry, so many people living in poverty, that it's way more than a lead problem in that community.
Dr. Roy asked about some of the other top toxins that affect Philadelphia, and you can say by extension Northeast children, and what the messaging is to reduce those exposures.
Thanks, Dr. Roy. I don't know if Dr. Roy can unmute and actually speak. Dr. Roy is actually an expert on this topic and might like to make some of their own suggestions.
No, because you were right. The framing of it is, well, if lead is the only big bad toxin, we should be doing everything we can. But what are some of the other toxins, right, that you see often in your clinic and we are not talking about enough, and we should be?
Yeah, well, certainly, Philadelphia now is actually going through a little mini epidemic of child asthma exacerbations, and we know that child respiratory illnesses are on the climb, and we know that exposures to toxicants in the air and to climate change are having a huge impact on children's health. That's why our PRC CEH, under Marilyn and Jessica and everybody and Eamon's guidance, is really making a push to really look at climate change and how that's affecting children. I still see routinely children with elevations of many of the other metals and mercury and arsenic and the way that they're being used. And again, we're making efforts. I could show, they came in and took my old mercury thermostat out of my house. So I have it here as a show and tell item. And as we make room that way. And then a lot of our environmental colleagues, both locally and around the country, are looking at plastics, both microplastics and the chemicals like phthalates and BPA. Dr. Bill Gaynor is a cardiothoracic surgeon at the Children's Hospital of Philadelphia. He's very interested in neurodevelopmental outcomes of young children who have had cardiac surgery as newborn infants. And some of the papers he's published looking at their exposure to these chemicals that leach out of plastics from blood products and from endotracheal tubes and things is really quite stunning. And so I think it's everywhere. And so again, it's doing this research to decide how can we reduce all of these to as low as we can reasonably achieve.
Say goodbye and thank you so much for what a great presentation and for all of the work that you do for the children in Philadelphia.